it's a good thing when you have a job to do before you actually have to move into the awards ceremony. And I do have a little job to do because in just a few hours at the TED conference in Vancouver, 7 social entrepreneurs will take the stage to share their biggest, boldest ideas to create a better future. To support those ideas, TED is launching the Audacious project, bringing together serious funders with the people and teams who have truly phenomenal ideas ready for world-changing scale. The Skoll Foundation is proud to have partnered with TED over the last 3 years to create and test this opportunity. In fact, Chris Anderson will tell you that the birth of this idea actually happened at a breakfast that he and Jeff had a few years ago. I am so pleased that 2 of TED's Audacious presenters are Skoll awardees, and that Chuck Slaughter, who is partnering with Raj Punjabi on one of those audacious ideas, is here. Chuck, will you please share a few words about what the audacious infusion of capital and the even more important infusion of true partnership is going to mean for the women and children of Africa? Chuck?
This is not in the script. I just have to say, the story I'm about to tell, it will be no surprise to all of you that the woman standing to my right played a powerful, indispensable, but completely quiet role in making this possible. So, thank you. Having a little deja vu all over again. 10 years ago, Living Goods and our partners at BRAC launched in Uganda with a simple goal: to save kids' lives. Today, 5 million people there can call any time to have quality care delivered to their door by a local community health worker, empowered with our Smart Health app, created by our friends, the wizards at Medic Mobile. Today, in Uganda, we are reducing child deaths by over 25% at a cost of less than $2 a year. Two years ago, as you know, I was honored to be on the stage receiving a Skoll Award on behalf of Living Goods. And a year ago, my good friend, Dr. Raj Punjabi, was here receiving the same award on behalf of Last Mile Health for their absolutely fearless work in Liberia. Raj and I are both dads of 3 kids, and we share a simple, powerful vision that one day every community will have a community health worker so that every child can celebrate their 5th birthday, just like ours. And like so many of you, Raj and I know that realizing this vision will take an unprecedented, wall-breaking kind of collaboration across sectors, implementers, and funders. And we know this because we are amongst a community of change makers in the public health space who have spent a generation innovating, creating, and building the platform on which our endeavors are based. So many of you are here with us today. Today, I'm delighted to announce that Living Goods and Last Mile are committing to deploy 50,000 digitally powered community health workers serving 35 million people. That's a population greater than the countries of Finland, Sweden, Denmark, Norway, and Ireland combined. That's possible today because a group of visionary funders are joining together in an unprecedented matching pledge to anchor our plan. And to magnify that impact, they're committing to match new funding sources 1 for 1. To realize this vision, we're looking for 4 new country partners. We're committing to make our technology open source, and we're going to make smartphones for community health workers free wherever we work. At least 1 billion people need a health worker. So this major new commitment is just a start. It's not a culmination. It's the kindling. It's the kindling that we hope is the fire that leads to a bonfire of community health equity. So how did this diverse group come together around this big idea? Credit to our partners, Chris Anderson and the amazing TED team, for being the matchstick and the magic behind this profound and powerful new platform, the Audacious project, which you'll be hearing a lot more about in the coming days and weeks. Importantly, this partnership is already proving to be greater than the sum of the parts, and that's the real power here. Our collective voice, vision, and scale is bringing together the policymakers, the thinkers, and the institutional funders to start collaborating on building community health systems that are durable and national. This is what it takes to tip the scales of equilibrium. So our collaboration is proving infectious in a good way. If this, let me just say also that it shows, I think, for us that when committed partners are willing to sort of drop their defenses and link arms, that big change is possible. So if this is the kind of contagion that any of you would like to spread, come find us and let's get to work. Thank you.
Nicely done. That was great.